suspect to have been originated that virus. So, new strain of coronavirus, what does it mean? We are all suffering from, we all suffered from common flu, right? Common colds, common flu, which only lasted for a couple of days, maximum of a week. So that specific virus is within the same family of the common colds and flu, but new strain. And that strain is resistant to the current treatment method as of today. So meaning there's no cure. Coronaviruses are a large family of viruses that are known to cause illness in humans and animals. So it is cross-contamination, meaning you can get it from animal, the animal can get it from you. That's why it spreads very fast. Any living creature can be affected. In humans, this large family of viruses is known to cause illness ranging from common cold, as I've said, to pneumonia. Pneumonia is our flu. What are the symptoms of this virus? This is the tricky part, people. This is the very tricky part because the symptoms is also the same with the symptoms of the common colds that we ignore or sometimes, part of our experience during seasonal changes. So the symptoms are fever and cough, shortness and difficulties in breathing, congestion in the nose and throat, colds. In advanced cases, the patient can have very serious complications which may lead to death, such as severe pneumonia and renal failure. This disease may lead to pneumonia and renal failure because it is progressive and it is very fatal, it's very fast. No medications can stop this. That's why it may lead you to renal failure. Not only the renal failure, but as they've said, because they are, as of now, they're currently discovering something new to this disease. Sometimes multiple organ failure and, as some cases, liver damage. So this is currently under study as of this very moment. But the concrete fatal complication is this pneumonia and renal failure. What is pneumonia? Failure of respiratory system. Renal failure, shutting down of your kidneys. Can it be transmitted from person to person? Yes, of course. The ways of human to human corona transmission includes the following. Direct transmission through droplets produced during coughing or sneezing. Droplets, saliva. Common misconception, people believe that it can be transmitted by airborne, through air. It is not. It is transmitted by your saliva droplets. So meaning, if you sneeze, and I sneeze, for example, with Sir Fatih here, within 1 meter, if some saliva got into him, you will get infected, but not airborne. For example, if this disease can be transmitted airborne, I don't have to sneeze, I don't have to do anything, I just need to breathe and we can be all infected in this room by the spores of that virus that can travel through air. But this one, it's not. It's through saliva and sneezing. Indirect transmission through touching surfaces and devices contaminated with virus and then touching the mouth, nose, and eyes. So meaning if I sneeze here, the virus will stay here in this part. So if you touch that, which is called indirect transmission, you can contact that virus. That's why hand washing is very important, people. Direct contact with infected patients as touching or shaking contaminated hands. So, let's not trust anyone. It's very, no, that's only a cracker. But, meaning, after you shake hands with people, especially us, they're people, if we see each other, we shake hands all the time, right? But after that, you can wash our hands. Hand washing is very important. That's why I strongly suggest that afterwards, I will handle that with you. And the hand sanitizer, which is all over the place as of this moment. What stuff need to do? If you are in one of the affected countries and experience the flu-like symptoms, mentioned, you should seek early medical advice and not to go to work until you are feeling better. If employees do come to work with the flu-like symptoms, they should be sent home and seek medical advice. This one I admire from our company because we have a memo that every person who just came from vacation must go to the hospital before resuming work, which is very nice. We implemented that as early as we got the memo. So we're currently doing that. So the countries affected are most of our countries. India, Egypt, all over the world maybe. It's currently 50 countries, right?
Yeah.
50 countries, Philippines including.
No, 90.
170.
Yeah, 107. Yes, I'm not sure about the statistics about that because it's currently progressing. But here in Saudi Arabia, as of this very moment, we have 84 cases and 1 recovery.
Where in Saudi?
It's all over the place, sir, but the epicenter is in Qatif, Al-Qatif. We have also cases in Jeddah, 20 cases in Jeddah. Some cases it's not clear actually the statistic and the major cities affected, but they only specified Qatif city as the epicenter. It's the news here is not that very vocal about what's happening. But as of the released data by the government, Ministry of Health, Al-Qatif is the epicenter and all the statement is in general already. They only mention the current confirmed cases, which is 84 at this very moment. So, avoid close contact when possible with anyone who shows symptoms of illness. This is very tricky also because as I said a while ago, the symptoms is the same also with the common flu. So let's think in general, let's think, let's not judge the person, but we must think of the worst. So if the person is having sneezing, coughing, fever, let's try to distance ourselves, especially in the public. But here in the workplace, it's my responsibility to check upon the people who are entering and working with this kind of symptoms. I send them immediately to the hospital. So cover your mouth and nose with medical masks, tissue or sleeve or flex elbow when coughing or sneezing. Throw the used tissue into a closed bin immediately after use. Dispose immediately in a closed container. This tissue paper. If what do you call this one? The flex with elbow sneezing. Just do like this if there's no available mask or tissue paper. Wash hands with antiseptic soap or alcohol-based hand rub frequently and especially after contact with respiratory secretions. Hand washing. It's very simple to hear. Hand washing. Just wash hands. It's very simple, but that is our one of the number one defense against this disease because that's the only thing we can do. There's no cure. Hand washing. Improve your immune health. Eat healthy. Body hygiene also. That's the only thing we can do as of this very moment. Stop traveling to affected areas. So I will make this specific, not only in affected areas, but here in our situation, let's avoid crowd because we are also near in a very public-based city, a center of commerce. Let's not bring ourselves, gallivanting all around the place if we don't need to. Because we cannot, as I've said, we don't know where those people came from. We don't know which is which. It's better to be safe than sorry. Way forward, World Health Organization till now does not advise special screening at points of entry with regard to this event, nor does it currently recommend the application of any travel or trade restrictions. Why? Well, based on this is very subjective on the World Health Organization. They just released this statement without, maybe the reason is political or whatever. There's no substantial reason regarding this statement. and sometimes contradicts because this is work in progress as of this very moment. Who expects that more cases will be identified? Our department continues to closely monitor the situation and will communicate changes on a regular basis because as of this very moment we are discovering cases here in Saudi. There's no very concrete intervention or approach, only prevention, which start within ourselves, especially us in this team, because we are responsible for those people outside. Till now, no warning, meaning there's no cure, there's no specific steps on how to combat this disease, only in general, which is hand washing, hygiene, improve your immune system, those sorts. Closely monitor the situation, that's what they're doing, they're just monitoring while the research on this disease is on progress, while the cure is in the making. Healthcare providers are advised to be vigilant among recent travels returning from areas affected by this virus who develop respiratory infection. This is together with the HSC team, we are enforcing this in our company. Those people who came from vacation. Healthcare facilities are reminded of the importance of systematic implementation of infection prevention and control. We have that already, right, sir? Containment plan. We devised that already. Starting tomorrow, I will systematically implement that before entering the workplace. I will check all the patients' temperature using this very simple but helpful device. I will check their temperature before entering the gate. They will vacate the bus outside and I will stay in the guardhouse and check them one by one before entering. This will not affect the workload because it's very, very fast. For example, I'll just on the device and just, may I, sir?
No problem.
And just put it in front of his forehead and that's it. Well, you have fever, sir. Just joking. 36.8, normal. And then also assessing for those other symptoms, which is sneezing, colds, cough, productive cough. Those sent information a while ago, not only temperature. And if they qualified in my classification, I will just list their name and immediately refer them to the hospital because that's the most effective way to treat the infection.
I still have 2 times to check this.
Sir?
2 times to check again today, inshallah.
Yeah.
As per our GO, it is 3 times.
Yeah, I take now 1. So still 2 for me.
Yeah.
Every second, monitor party, huh?
Yeah. But I will not use this after your meetings because I know your
Yes,
head is
sure,
hot.
sure.
This one.
Pressure on this.
So from someone who has heavy cough, yes, I've mentioned that a while ago. Use tissue. Yes, done. If tissue is not available, this I've mentioned a while ago. So I have this 3 footage of very short videos regarding additional information regarding this. So please bear with me, people.
शुरू तो हिस्से में नहीं होने वाली
This is our number 1 arsenal regarding that virus, hand washing. This is the proper technique on how to do it. It's very simple.
ये सारा वजू वाला तरीका
Yeah. You can do it fast and hard. It's not like, you know, you will follow that slow motion, fast and hard. But minimum of 20 seconds ideally. That's it. But we cannot do that anywhere, right? That's why we have the hand sanitizer. But please, if you use hand sanitizer, do the same technique also as the hand washing technique. Do the same so that the hand sanitizer will distribute and your palm will create friction to eliminate the virus.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person sneezes, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
That's the very specific video regarding the mode of transmission of the disease. That's why it spreads very fast and very lethal.
خمسون بالمئة من حالات العدوى المكتسبة بالوجهات الصحية يمكن تجنبها بتطهير اليدين.
That's all, people. Any questions? Any information?